it's very country specific, because not everywhere all products or components of that chelation are allowed in all countries. So I'm a bit skeptical about that. Frankly speaking, I'm a bit skeptical because it is in quite high percentage associated with certain risks. So as long as the procedure is risky and the benefits are equivocal, I would not really be much of a support for that.
So like benefits are quite negligible here, and then the risk is here, no go.
Well, yeah, there is a risk, definitely.
Agree.
And it's not allowed universally all over the world, so you're going to be very selective. And then I believe I need to understand if it's really necessary.
Yeah, it's not something that everybody should have, right? It's also very targeted.
Of course not. No blanket rule for that, definitely.
Okay.
It's not a safe, 100% beneficial procedure that can be just easily recommended to everyone. Definitely no. Unless, if somebody has a specific indication, if somebody, you see.
For example, like what they need.
In medicine, when you have a specific disease that is associated with the excessive deposition of a specific byproduct in your body, like thalassemia, for instance, and there's because of that constant breakage of the hemoglobin, the RBCs, there's a deposition of iron in the soft tissues, in the heart, in the bones, and it is associated with toxicity and reduced lifespan and impaired cardiac function. Well, then
it's needed because
it's justifiable, and there are specific protocols for that
the length of use
definitely are proven to be effective, beneficial. Then yes, when you do it for the purpose, it's purposeful.
Okay.
But doing chelation for
general
wellness, definitely not a good idea. No.
Okay. Thank you. Yeah, because I think sometimes the viewers, because this sometimes come back from the viewers as well. They were saying, should I try this? Should I try that? Because in our discussion, there's a lot of people who, again, like to experiment on themselves, and so they did some reading. They heard, someone say, oh, we should try this out, and then they do, and then, again, they don't realize the risk. So again, the idea of the Meet the Expert session is also to talk about and debunk, certain myths that.
Compared to that, what I really find safe, reasonable, rational, and effective way is like the HMD. HMD stands for the Heavy Metal Detox. It's the oral product. It has few ingredients, few compounds in it. Some have a biophysical mechanism of action. It means that they act only in your gut. Okay? They are not absorbed. They do not cross the barrier, from the gut into the blood. They just purely work in the blood. They're capable of attaching or capturing either toxins or some heavy metals because of a negative charge of that, that small molecular structure. The product, that it can capture certain positively charged heavy metals and just excrete it together.
That sounds much safer.
Okay?
Yeah.
And other components are just herbal components that have that mild systemic detoxifying effect, which proven has got no short or long-term risks or whatsoever. And there's
really
no danger. And can be used by practically everyone. And of course there are specific guidelines, how to use that. So if a person is taking any sort of form of vitamins, supplements, medications and whatsoever, and together with the HMD detox, then there will be a chance that the effect of the supplement or medication will be a bit reduced, because they will be also sort of captured by this product, and eliminated. So when you explain when and how it has to be taken, what is the minimum time duration between the medicines and the supplement intake and the HMD detox, how exactly you mix it, with what you mix it, whether you mix it with juice or just water, these are very, very important things, as long as you've done that correctly. And then also you should be able to minimize such things as, it might make a person be prone to constipation, especially those people who are not getting enough fluid. Or fiber or fluid, so those, as long as you take those nuances into consideration, you explain the protocol how it goes absolutely smoothly.
Nice.
Clients love it.
Yeah.
I love it myself. And absolutely safe. You can take it for a very long time. Very long time, and you can really enjoy that.
And you feel the difference when
you? Oh yeah, definitely.
Very good, very good.
Yeah, the sort of the comfort of the digestive system is tremendously higher. There's so many symptoms of that. Either the fullness immediately after the food intake, or then discomfort that comes along later, and then the bloating, all those things are minimized.
No, that's so
starting from the less reflux to less bloating, and then generally you feel lighter. Okay, and in a long term, you see, who said that? Death lives in the intestine.
That's deep.
It was said, you call it meme, right?
Yeah,
but it was said by some physician from the medieval times, something like that. Don't remember exactly who said that, but there's so many skin conditions which are related to the gut, brain conditions, even the ASD. There's a
you found a link to it.
Link between the gut health and the neurodegenerative conditions. When you improve the digestion, there's so many things come tomorrow. The psoriasis and eczema, various autoimmune and skin conditions, the allergies, not to say that it fully disappears, but there's quite often there's a tremendous relief, dramatic improvement. That is the holistic, approach. When on one hand you identify the allergen, then you identify component that makes that you are intolerant, the person is intolerant. Okay, you eliminate that. Might not still be 100% effective. Then you apply certain therapeutic methodologies
to add on to that,
and to further optimize that. That is the way to go. That is definitely the way to go. And together with the detox on one hand, with say hydrocolon therapy, with after that followed with the immediate just 1 or 2 episodes of reintroduction of the normal flora. You don't have to give those probiotics for years or months and all. Just after the session of hydrocolon therapy, that's what the protocol says.
Because it's all cleaned up, you just want to reintroduce.
And you reintroduce, and then you normalize diet, and then you give a specific detox product like the HMD in the form of the supplement. Just a sachet you open and mix, or just with a scoop.